So good to be here. I'm so glad to see all these faces from all over. I'm impressed that you guys are giving up some of your Sunday to do this, and I hope that we can talk together and learn together to talk a little bit about environmental health and sort of my career path, especially from a global perspective. I want to start off and I want to ask you guys a question. And this is, I'm hoping it'll be interactive if you guys are willing to work with me a little bit in the chat, or you can shout it out, just unmute yourself. I want you to answer the question, what do humans need to live? This goes back to like fourth grade biology, right? Let me see. Water, food, oxygen, shelter, water, oxygen. You guys are awesome. Yes, 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 yes. Thank you so much. Okay, so my 14-year-old daughter says that she needs her fancy clothes and fancy phones and everything like that. But I crossed that out because, as she has heard me say multiple times, she does not need that. But what she and I and you and everybody else needs is oxygen. All right, where does oxygen come from? Another basic biology question. Go ahead and type that in the chat next. Where do we get oxygen on planet Earth? Plants, trees, photosynthesis. Awesome, you guys are getting it. Very good. So plants produce oxygen, and what do plants need? They also need water. So we need water, plants need water. And then also, of course, they need sunlight and carbon dioxide. Somebody mentioned photosynthesis. And these plants become food, right? We eat plants. And I want to also just say too, though, that in addition to, these basics, we need sleep, but, a shout out to the Beatles. All we need is love, right? But the point of this is, unlike oxygen, there isn't anything that makes water, right? So water is a limited resource. We only have so much of it on Earth. Most of the Earth is made of ocean, and we can't drink that, really. I mean, we kind of can, but we're not very efficient at that. Less than 3% of the water on Earth is fresh, and only some of that is actually drinkable. And so a lot of people like to think of the Earth as a fishbowl. And there's these natural resources like water, and there's energy resources and environmental services like plants, which make oxygen. And the only thing that comes into this fishbowl is sunlight. And the only thing that leaves this fishbowl is heat. So it's like a closed system, our Earth. So here's the fishbowl. Here's all the natural resources, only heat and energy can come in or go out. And if you think about a fish in a fishbowl, like if you live in the US, a lot of times you go to a fair and maybe you win a little tiny goldfish. The goldfish end up usually dying because if you don't have a balanced ecosystem, they don't have anything to eat, and then they poop, and then they basically choke on their own poop. And so the world is actually kind of very similar. And our world, the population has been increasing dramatically over the past 2,000 years. If we are growing the number of people on the planet, then what else is growing? Our waste, just like the fish in the fishbowl, right? And so if anybody uses plastic bottles, as an example, plastic can stick around for 10 to 30 years. Some types of plastic stick around for 450 years. And so when we are generating all of this waste, it's building up on planet Earth, and basically can impact our health. Now, this is an old picture of a landfill in the US. They don't look like this anymore in the US, but around the world, there are still lots of examples of landfills like this where trash is dumped. And what can happen is a lot of the chemicals that are found in the trash can leach into the ground, and then they get into the water that flows underground, and they can end up making us sick. a lot of places actually burn their trash. This is in my hometown of Baltimore. It's an incinerator. And so as we burn trash, then there are pollutants that are released into the air, and then they can also land on the ground. And sort of like in this picture, which is showing the waste from a chemical plant. So when we make all those fancy gadgets and all those fancy clothes that my daughter really wants me to buy her, that manufacturing has waste products, and that waste can be released into the air, and it can be released into the water, and we can breathe it in the air, or it can deposit onto the ground through the air. And then maybe when it's on the ground, maybe it gets onto plants and animals eat it, and then we eat those animals. And so all these chemicals and all this waste that we're generating builds up in our environment and ultimately gets into people. And that's sort of what my field of environmental health is all about studying. Now, this is an example of just some of the impacts of smoking on our health. Everybody knows smoking is bad for you, right? But if you think about it, smoking is basically breathing in super polluted air, right? And so my point in showing this to you is when we are taking in all of these pollutants and all of these chemicals, we're impacting our health, right? And I do want to point out, I always think on this slide, it's really interesting because everybody knows, like, lung cancer impacts your lung, or I mean, smoking impacts your lungs, and lung cancer is a very common outcome. But there's other outcomes that people might not even realize, like congenital defects from if your mother smokes, you can get a cleft palate. Men can experience erectile dysfunction because of smoking. Women can have ectopic pregnancies because of smoking. There's a lot of impacts of smoking or breathing in really polluted air that a lot of people aren't even aware of. This statistic blows my mind. Pollution kills 3 times more people than AIDS, TB, and malaria every single year. But the interesting thing is our public health systems are more focused on AIDS, TB, and malaria. And I really think we need to make a shift in the field of public health to talk more about this pollution. I'll just throw out there just food for thought, and maybe this is something we can talk about at the end, that there is a reason that it's easier for us to focus on AIDS, TB, and malaria than it is to focus on pollution. And there's lots of reasons, actually, but one of those reasons is pollution comes from somewhere. And pollution comes from big industry that makes a lot of money. And so big industry often pushes back against people who fight pollution. Whereas AIDS, TB, and malaria, there's nobody out there who's like trying to spread those things, really. So there's less political pressure to fighting AIDS, TB, and malaria. So the other thing that we spew into our environment, into this fishbowl that we live on called Earth, is greenhouse gases. And so greenhouse gases, everybody knows, leads to climate change and extreme weather events. But a lot of people don't think about the health impacts of climate change. So for example, we just talked about air pollution, so climate change leads to more air pollution, and that leads to asthma and cardiovascular disease. But it also leads to the changing weather leads to changes in vectors. And vectors are things like mosquitoes that carry diseases. So we're starting to see different diseases in places where they didn't used to exist. And we're having longer seasons where those diseases can be spread because the mosquitoes are living longer. And there's all sorts of health impacts related to climate change. All right, sorry, I just keep trying to check the the chat every once in a while. I can't fully keep up with it, but I'm going to try to look at it as much as I can. So this is a list of diseases that are also linked to environmental exposures. Just to give you an example of, there's pretty much everything can have an environmental cause. And so this is the field of environmental health basically looks at how our environment impacts our health, whether it's the air that we breathe. This is pictures from the London fog events in the mid 1900s. This is actually at noon, so it almost looks like it's evening, but it's not. Or whether it's the water that we drink. This is from the US, where fracking or unconventional oil drilling occurs, and methane can get into your water. So your water can be actually flammable. So I'm not sure he should be drinking that water. Or whether it's the neighborhood in which you live. All of these things in our environment can impact our health. And so our field tries to examine how we can make our environments healthier, to make our lives better. So the leading causes of disease around the world, it's, for the most part, it's not infectious diseases, right? These are chronic diseases: ischemic heart disease, stroke, chronic obstructive pulmonary disease, lower respiratory infections, neonatal conditions. But so these aren't caused by infectious diseases. And, genetics explains part of these, like what causes these. Behavior, like smoking, explains part of what causes these. But environment also plays a huge role in all of these chronic diseases. For example, I mentioned neighborhood on the last slide. So if you live in a neighborhood that was designed for cars and not for walking or biking, then you're more likely to drive. And if you are more likely to drive, you're less likely to walk and bike, and you're getting less physical exercise, right? And so part of my work looks at, in the US, how do we design communities that are more encouraging of biking and walking, so that we can get people out of cars, which pollute, right? And which spew greenhouse gases into the atmosphere, and get them doing more physical activity. So this is another way of thinking about diseases worldwide. This is from the World Health Organization. It's quite a few years ago, but it's still probably very similar now. And what you see is, when it comes to environmental issues causing disease, the biggest cause of disease worldwide is indoor smoke from solid fuels. So basically burning a fuel in your house it basically creates indoor air pollution. And then unsafe water, sanitation, and hygiene are also really big causes of disease. And we're talking, so these numbers are in the thousands. So actually what this number right here means is 2 million deaths are related to the indoor smoke, and almost 2 million deaths related to unsafe water, sanitation, and hygiene. So imagine if we can solve these environmental issues and clean up our environment. Imagine the number of deaths that could be prevented, and lives that could just be healthier and have a higher quality. A lot of what we're seeing in the environment is linked to urbanization. And so what you see on this is just the years on the bottom and the percent of urbanization. And the blue diamonds is the world. So if you look at this line right here, basically you see people are moving away, or they're moving toward cities. And this is a result of basically globalization. So when you talk about globalization, it's basically this exchange between countries and regions of the world of economic, social, cultural, and political ideas. So urbanization is the move to urban areas or cities, so densely populated areas. And so globalization is characterized by financial rewards to developing nations to export their natural resources and to export agriculture. It also is characterized by traditional farming methods being eliminated as like big corporate farms emerge. And it's also characterized by migration. So people will move toward the city in search of resources, often jobs. People think that there's going to be more jobs and better education in cities and more opportunities for them. And so that's why they're moving toward the city for urban, and that's why we see urbanization. So what this basically is meant to show is that as people move into urban areas, the infrastructure does not follow them. And so as countries become more urbanized, we aren't seeing an increase in the number of things like improved sanitation facilities. So city infrastructure, things like water that can be piped into homes, isn't able to handle this increasing population. And also wastewater. Cities, as their numbers increase and increase, their ability to get rid of the wastewater out of residential areas, it becomes compromised. It's too hard. There's too much waste being generated. And the same goes for our waste. Okay, and I see you're putting questions in there. If I don't get to your question I'm going to save most of them till the end. But here's an example of waste. So as we urbanize, we don't have infrastructure to get rid of the waste. So this is not a landfill. This is just a dump in a town where everybody just takes their waste. And this can be very unhealthy, can lead to lots of rodents and flies and smells that might impact our health. It can leach into things that can leak out of it, can leach into the groundwater. And so urbanization can lead to increasing air pollution, because as we move to the cities, a lot of times there's more air pollution from vehicles, especially unregulated vehicles. So in a lot of countries that are becoming more urban, it's really hard to enforce regulations. So say a country says your car has to meet certain standards, it can't pollute the air. But if the country doesn't have enough people to inspect cars, then they're not really able to enforce what is a good law. And so outdoor air pollution is one consequence of urbanization, and as is indoor air pollution. And so as more people move to urban areas, a lot of times they're moving into maybe high rises with smaller areas that they live in, and windows don't open. And so you'll also see greater indoor air pollution. Urbanization is also linked to unsafe water because of what we talked about before, and infectious diseases. When people are living more closely together in close contact with each other, then there's more likely that disease will spread. And we already covered waste disposal. And then also there's social behavioral impacts, some good, some bad. We're going to be more social. If we all live near each other, we're going to talk to each other more and maybe be less lonely. But living in a city can also lead to more stress too. There's a lot of noise, there's more crime, and there's other sort of maybe negative impacts. So I talked a little bit about climate change and its impact on health. I just want to show you this. The point of this is the people who are most vulnerable, the red, to climate change, most vulnerable to climate change, are the ones who didn't necessarily create climate change. And so there's just a lot of equity issues when it comes to climate change. And so now the countries that did basically like cause the majority of climate change, they are developed, they did all their pollution, they built all this industry, and now they're saying to the world, oh, we need to stop um generating greenhouse gases, and so it's not always necessarily fair. And that's one of the things that we see at the COP summit, where all the different countries of the world come together and talk about climate change. The countries who are most vulnerable are saying, well, USA and China, you guys are the most responsible. You need to help us. But the point of this, when it comes to climate, is it's an equation for disaster, this climate change, because it's going to lead to the migration of millions of people. As droughts occur, as floods occur, people have to leave their home and they have to migrate to other areas that aren't flooding, that aren't drought stricken. And so that means that the scarce resources in the areas that aren't drought stricken and aren't flooded, they're going to start to be even more scarce. And that includes energy too. And that also leads to shrinking economies. So if there is this drought, if there are floods, that means that your crops are ruined. And so you're not going to have as much to sell. And it's going to be harder to make your way in the world. And then this is all happening in places with already stressed infrastructures and ecosystems. And so what that leads to is conflict. So a lot of people have talked about war over food and land and water and energy and refugees. And in fact, this article published by Julie Snorak looked at the top 10 environmental conflicts worldwide. She was able to calculate there's 600 conflicts over land grabs. So when somebody comes in and says, we're gonna take over this forest, and we're gonna start, using it, and it's not their forest to take. And so that leads to conflicts, and that can happen with mines, it can happen with farmland, it can happen in lots of different ways. There's 326 conflicts around the world over water infrastructure. Here in the US, there's people who live at the top of water source, and they pollute it. And by the time they use all the water, and by the time the river makes its way downstream, it's not usable anymore. And so there's conflicts here in the US over water. There's 270 conflicts over mining. I'm not going to go through all of these in detail, but I just wanted you to see that already climate change is leading to these conflicts around the world. And this is a picture of the article in case you want to read it. So you guys, one of the things that I was asked to talk about was career paths. And one of the cool things about our field, environmental health, is you can do a lot of different things in our field. You could be a disease detective or epidemiologist. You could work in a laboratory. You can work as an inspector, making sure that places are up to code and up to regulation. You can be a toxicologist. You can study the impact of toxic substances or poisons on the body. You can be a biologist and work in environmental health, a chemist, a physicist, a mathematician, a physician, engineer, anthropologist, nurse, lawyer, social worker, first responder, communicator, policymaker, teacher, planner, community activist, or veterinarian. I know somebody in each of these categories who works in environmental health. And so that makes our field really diverse and really multidisciplinary, and a really interesting place to work. And the cool thing too is if, say, you work in one area, I used to work with laboratorians. That was my main job. But now I would say that I work more with teachers. And so if you get bored in the field of environmental health, there's always something different that you can do. So I'm going to tell you a little bit about my career path and maybe hopefully give you guys some words of wisdom as you guys start to think about what you want to do with your life. So this is me as a college freshman at orientation. And I came into school as a biology major. And what I ended up realizing was I did not want to go to medical school and I did not want to work in a laboratory. And so I was kind of lost for a while. And what I ended up doing is I went to every single career event at my university and applied to all these different jobs, like to pharmaceutical companies. And I ended up working at an insurance company. And I was handling claims that had to do with the environment, health claims. So, for example, maybe my insurance company had insured a factory where they used asbestos, and some of the workers got asbestosis, or they got lung cancer, or they got mesothelioma, and they sued their employer. And they said, I got this disease because of my work at your company. And I had to defend the company. And some other like types of cases I had were some children who had lead poisoning. They had sued the landlord where the lead was in the paint on the walls. And I had to defend the landlord. And I had to say, it's not his fault that you got lead poisoning. It's your parents' fault. And I felt like I wasn't really on the right side of history. And like, I was like, this is not what I want to do. So I called one of my old professors who I really liked. And I said, Dr. Bessman, what should I do? I want to make the world a better place, but I want to use science to do it. And he said, oh, Megan, you should go into public health. And I said, oh, Dr. Bessman, I think the people who travel all over the world and they live in tents and they don't have hot water, they're amazing people and they give vaccines and they save lives. I said, but I can't do that. That is just not who I am. And he said, oh, Megan, you don't know what public health is. You need to go talk to some people. So he introduced me to some folks, and I include his picture here because he died 2 years ago. And so I just kind of like to memorialize him a bit because he introduced me to this amazing field. And so I went to graduate school. I got a master's in health science at Hopkins. Here I am. This was like a group that we worked with local students in Baltimore and helped them with reading and homework. And as I was finishing my master's, I got my master's because I needed to learn about this new field and get a job. All the jobs I looked at either required 10 years of experience or a PhD. And I didn't want either of those things. So I went to my advisor and I was like, Dr. Schwartz, I was like practically in tears. I'm like, I don't want to get a PhD because I don't want to do research. And I don't want to wait 10 years to get my dream job. What am I going to do? And he said, Megan, he said, if you stick around and get your PhD, it's only going to take you 4 years. And there's a scholarship. It would be free. So I was like, okay, fine, I'll get a PhD. And I'm so glad I did. But I tell you these stories because I want you to see that my career path was not like, I didn't have my mind set on something. It was very, like I loved biology, but I didn't want to be a doctor. I went and talked to somebody and he told me about this new field. And then after I got my degree, I didn't like the jobs that were out there. And so I ended up getting a PhD. So nothing was, easy. But after I got my PhD, I ended up doing my dream job, which was working in policy. So how we take the science and how we make laws or regulations, or how we change the way that people do what public health or environmental health. So this is me. I worked in DC for almost 15 years in Washington, DC on environmental health policy. This is Dr. Henry Falk. At the time, he was the head of environmental health for CDC. So the job that I had when I was talking with Dr. Falk there was at the Association of State and Territorial Health Officials. And so basically in the US, every single state has a health official, typically appointed by the governor. And so this organization had 57 members, one for one of each of the 50 states, plus DC and the territories. And the members were often really busy putting out fires. And they often only stayed in their role for like 2 to 4 years because they were appointed by the governor. And I found it really hard to get them interested in environmental health. So I was the director of environmental health at this organization. And it just never rose up to the level of something that they seemed to care about. And so what I did, after 9/11 happened, the state health departments all started hiring a preparedness director. And so ASTO put together a group of these preparedness directors so they could all talk to each other. And I thought, well, gee, that's really smart. I want to do that for environmental health directors. And so I told my boss, and my boss was like, well, if we do that, then maybe the group is going to form their own separate group, and then they're going to compete with us for funding. And I don't know if that's a good idea. And then I told my project officer at the Centers for Disease Control and Prevention, CDC. She was like, she's like, we don't really have funding to do that. And all these people, like nobody really thought this was a good idea except for me. But you know what? I did it anyway. So we formed and I could tell you all the little like steps along the way that I had to take to win people over. And I had never got any funding to do it, but we formed the State Environmental Health Directors Group, and they're still around today. So I think we formed them in 2005. So they'll have been around almost 20 years, and they impact policy and they talk to each other. And I think it's been a really important move for the field of environmental health. But my point in telling you that is I didn't have support for the idea, and I did it anyway. So another journey that I want to tell you about was in 2009. That was a big year for me. I was actually at the time working at the Association of Public Health Laboratories. And so I gave birth that year, and soon, so this was in February, and then in October, there was this big conference, the National Environmental Health Conference. So I don't know why. So I see, would bioengineering and neuroscience help out? Yes, we definitely have neuroscientists in the field of environmental health, especially neurotoxicologists too. So this National Environmental Health Public Health Conference was the first time I was away from my baby after she was born. So she was about 6 months old. And I don't know if it was because I had a lot of hormones still going on, or maybe it's because I missed this sweet little face that I'm going to show you in a minute, who was all dressed up for Halloween here. She was a cat. But I was at this section of this conference called the National Conversation on Public Health and Chemical Exposures. And in the back of the room, there was a woman, and she was holding a baby about my daughter's age. She looked kind of like my daughter. And I kept looking at this woman and kind of missed my baby. And I was really curious. So when she stood up and she started to talk, I paid attention. And so this woman had driven across 5 states in the US to come to this conference. And the reason she came is she said in the state where she lived, it was illegal, or it was legal to burn pesticides. But across the border in another state, it was illegal. And she said every night, these trucks would come into her state, into her neighborhood, and bring waste, leftover pesticide chemicals, and things like that. And the incinerator would fire up. And every morning when she woke up, there was this layer of ash all over everything. And she didn't really notice until her baby was born. And all of a sudden she was like, what is this? Should I worry about this? Is this bad for the baby? So one day she stopped a police car in her neighborhood and she said, hey, what is this stuff? The police officer said, I don't know. He said, why don't you call the Department of Natural Resources? So she called the Department of Natural Resources. And the DNR said to her, we don't know what it is. Why don't you call the Department of Environmental Protection? So she called the DEP. And the DEP said, we don't know if it is going to impact your children's health. Why don't you call the Department of Health? So she called the Department of Health. And the Department of Health said, you really should call ATSDR, the agency. This is a federal agency, the NCDC, called the Agency for Toxic Substances and Disease Registry, where after being bounced around from so many calls, when she Googled ATSDR, she found out they were having this conference. And so she drove across 5 states to try to get some answers for her child. Well, I'm sitting there and I'm hormonal and I miss my baby and she has this cute baby and I'm so angry and I get tears in my eyes because I just can't believe that so many people failed this woman, that she had to drive across 5 states to get this question answered. And I was so angry. And my friend looked at me and she was like, are you crying? And then that made it worse because then the tears started coming down my cheeks and it was so embarrassing. I was trying not to cry. But that really stuck with me. This woman, I gave her my card, but I thought, what am I going to do to help her? I'm just a director at the Association of Public Health Laboratories. I can't help this lady. And that's sort of like what I want to really emphasize in this talk is all the people whose children's lives are affected by the environment. This young woman died of an asthma attack. This little child had lead poisoning. And these are all just from newspaper articles that I found. And this little child, every night his mom has to go in and measure his blood sugar. And while he's sleeping, sometimes has to give him food so that his blood sugar is regulated. And I feel like we're failing these children. And so what I ended up doing at APHL, I told you this is where I was working, is launched what we called the National Biomonitoring Network. And the reason I'm telling you this story is, once again, this was something that I thought needed to happen, but nobody was doing it. And I would complain to people. I would talk to EPA and I would say, we need a National Biomonitoring Network. And EPA would say, yeah, sure, that's great. And I would say to CDC, we need a National Biomonitoring Network. And they would say, yeah, sure, that's great. And I said to my boss, we need a National Biomonitoring Network. And they said, yeah, sure, that's great. And I got tired of complaining and nobody doing anything about it. And finally, I realized, well, maybe I should do something about it. But then I thought, well, everybody's going to laugh at me. They're going to be like, who are you that you think you can create a National Biomonitoring Network? But I did it anyway. I took the risk and I was so scared. What I did is I got a lot of smart people in the room together. I brought together EPA and CDC and states and the National Institutes of Health. And I brought together epidemiologists and toxicologists and biostatisticians and all these different people, chemists. And I got them into a room together and everybody said, yes, we need this National Biomonitoring Network. And so I said, how are we going to make it happen? We had no money to do it. But we put together a plan, a strategic plan, and said, this is what it would look like. And this is the steps that we would need to take to build it. And so in 2016, the network launched and it's still going strong today. So I'm really excited that I was brave and took this step, even though I was scared. I forget what, I think I just wanted to put this in here just to remind you guys how the environment impacts our health. and how it can save not only lives, but save money. And then coming back around to that story I told you where I was at that conference and I cried, it stuck with me. And I kept thinking about this woman and what is community noise? So noise is sound. And so especially if you live in a city, there's a lot of noise around you, and noise is actually linked to cardiovascular outcomes. Maybe because if there's a lot of noise, maybe you don't sleep as well. And so your heart doesn't get as much rest. We don't know the mechanisms of it, but noise does impact your health. It can increase your stress levels. It can decrease your ability to focus, whether you're in school or at work. So noise is considered an environmental health issue. Okay, so going back to this lady, I kept thinking about her and kept thinking about her. First saw her in 2009. Fast forward to 2011. Or 2012, I was thinking about this. We had a network of laboratories that did chemical analyses, and it was underutilized. It had been built to respond to chemical terrorism. And fortunately, in the US, there wasn't a lot of chemical terrorist incidents. And so I was thinking about this lady and I thought, maybe the public health labs could have helped her. Maybe they could have tested the ash to see what was in it. Maybe they could have taken a blood sample to find out if there were chemicals getting into her blood or her children's blood. And so we created this program called Meeting and Community Health Needs Through Environmental Laboratories. And again, a lot of people pushed back on this. The laboratories were afraid they were going to be inundated with requests for help. They thought maybe people were going to show up and have urine in a can and they were going to say, analyze this. A lot of people really struggled with this idea. Now, I ended up leaving APHL and coming to Hopkins. And this is one of the things that has not continued to this day, this program. So I'm sharing that with you to show you that not everything I do has been successful. But I do think that taking risks and trying things, even if not a lot of people see the value or the support, is really important, even if you don't have funding for it. I'm going to tell you one last little quick story, and then I want to open it up for Q&A. So I came to Hopkins and I was really excited because I had always been committed to environmental justice and environmental equity. But working at the national level, you can't really work with communities. And if you're really going to do equity and you're really going to advance justice, you need to work at the local level. So when I came to Hopkins, I thought, great, I can get more involved at the local level. And I went to an environmental justice conference here in the state of Maryland. And I met the president of the Baltimore Transit Equity Coalition. And when he found out I worked at Hopkins, for the first 5 minutes, he railed against Hopkins and how bad we were when it came to transit and how we were contributing to inequity in Baltimore. And at first I was defensive. At first I wanted to be like, well, we're not that bad. But as he talked, I was like, you know what? Actually, we are pretty bad. But at the end, I said to him, you're right. And he's like, I am? And I said, yeah. I said, but I can't do anything about it. I'm just a faculty member at Hopkins. I said, what I can do is maybe help you collect data. And so we ended up working together. I'm going to show you a quick video. Let's see, share this screen about the project.
Until now, no one has looked at public transit in Baltimore through an equity and environmental health lens. When we did so, with the scientific and technical assistance of the Johns Hopkins University Bloomberg School of Public Health, we saw lots of inequity along racial and ethnic lines and lots of opportunity to better serve all the people in this city. I'm Samuel Jordan, president of the Baltimore Transit Equity Coalition, BTEC. We mapped 4 key metrics for Baltimore City: transit equity, social vulnerability, pollution, and health. In all the maps, a darker color indicates areas of greater need. When we mapped transit equity, we saw the patterns marking major differences between white and black residential areas. We also see opportunities to improve average commute time and the difference in commute time between those taking public transit and those using a personal vehicle. When we looked at social vulnerability, we again see racial differences emerge. The darker areas show neighborhoods whose residents are more likely to live in poverty or to be people of color. Looking at air pollution, we saw that areas close to the Patapsco River in the southeast had a higher burden of air pollution, possibly related to Baltimore's port industry emissions and the incinerator. When we looked at health outcomes related to air pollution, we saw again patterns indicating racial inequity. But downtown and areas along the water lit up as places for opportunities as well. To encourage investments in public transit, we overlaid all 4 maps to identify areas most in need of attention, equity, and investment. Let's work together to build a better Baltimore and connect those most in need of jobs, healthy food, education, and healthcare with exactly what they need through strategic investments in public transit.
What I want to tell you about this project was we didn't have any funding to do it. So I had told him, look, if what I can help you with is, collecting data. And so I said to my students, my undergraduate students, does anybody want to help on this project? And one of the undergrads volunteered, and I said, try to get us funding. So she put together a grant and it worked. She got funding. I never thought it was going to work. And then I thought, well, gosh, now we have funding. What am I going to do next? And I had no idea because I don't know how to make these maps. So I put together a team. I asked people to volunteer. I said, oh, you know how to do maps? Could you help us? And you've worked on bike maps. Can you help us? And we were just this motley crew of a team. And we put together this report on a shoestring budget, $20,000. And the report led to the passage of a bill called the Transit Equity Act. Here's Mr. Jordan behind Governor Moore. Signing the bill into place this year. So now Maryland, anytime transit is going to have any changes, they have to do an equity analysis, sort of like what we did. The U.S. Department of Transportation asked people to submit things on how they did equity analyses. And so we submitted our equity work, and they actually put together this tool that looks very similar to what we did. It looks at environmental issues, vulnerability, health issues, social vulnerability, transit. Basically, it looks almost exactly like what we did. And here we were this ragtag team with a shoestring budget. And I've been appointed to National Academies committees. And also one of the coolest things is some of the things that Mr. Jordan complained to me about when I first met him, I now have the power to actually implement because I've been asked to co-lead one of Johns Hopkins or like their new sustainability plan. And so I hope I leave you with the idea. I love this. These are some of our students, our master's students a couple years ago. And these are some high school students in Baltimore that I've talked to. This is, I think, from 4th grade students in Baltimore about public health and environmental health. The more that we have people like you learning about this space and working in it, I think the better off our planet is going to be. So my takeaway messages for you are don't use lack of resources as an excuse. If you don't have funding to do something, find a way to do it anyway. I also want to sort of emphasize that the public needs to be in public health. We need to involve the communities that are impacted from day one. So we can't just say we have a solution, we're going to do it. We need the people who are impacted to be part of coming up with the solutions. Everybody can make a difference. I kept thinking, who am I to do this? Like, I'm just some lowly person. I have imposter syndrome and I'm pretty successful. So I want you to know that everybody can make a difference in our own way. And I want you to, it should say think global, act local. I want you to think from a global perspective about things like climate change, but I don't want you to get overwhelmed. I want you to do what you can at your level where you live and just take as small steps. And then lastly, I think this is last, be a prepared opportunist. I once was at a dinner with the head of CDC's chief of staff, and I was so nervous and I thought, oh my gosh, this person's so important. What should I ask them? And so I looked at them and I can't believe I said this, but they were so nice about it. I said, so to what do you owe the secret of your success? And he said, I was a prepared opportunist. And I was like, what does that mean? And he said, as opportunities came along, I wasn't ready for a lot of them. He said, but I took them anyway. And so, you know, there have been times in my career where somebody has said to me, like when I came to Hopkins, there wasn't a job that I applied for. It was just, I talked to the chair and she said, I want to hire you. And I said, okay. And if I hadn't been prepared, I don't know where I would be today, but I'm really happy where I am. So that's it. I would love to open it up for questions. I'm going to stop sharing and try to scroll through all the chat. Is it Sian O'Brien or Keen? Sean?
Yeah, it's Kian. I appreciate you trying. When there are these large migrant populations, how is the sort of effort to assess a community's needs impacted? Like, yeah, when you can't necessarily count all the people in a community.
Yeah. A lot of times, migrants don't have the time or the resources, or maybe don't feel comfortable coming to the table to talk about issues and problems. We found this with our transit equity work. We tried to put together a community advisory group because we wanted the community to drive our work. But the impacted community, the community that rides transit in Baltimore, they often work like 4 or 5 jobs. And the idea of donating their time to sit on a community advisory group just wasn't part of what they were willing to do. And so I don't know if I really have a good answer to that question. I think you have to meet people where they are. And so if I had more time and resources, I probably would have gone to where that population was, whether it's their churches or their community centers or the farmers market, or, you know, where they shop and things, and try to collect information and needs from them.
Thank you so much.
Yeah, thanks. Danielle.
Hi, my name is Danielle. First of all, I just want to thank you so much for your presentation. Honestly, as someone who's very interested in public health, I think that the environment has been a topic that I do want to continue exploring. And my question is, like at the beginning of the presentation, you talked about pollutions and it killing 3 times more people and climate change causing air pollutants. So I just wanted to ask about a current event that recently happened, the forest fires in Canada, and what do you think the consequences of the recent forest fires would cause on the East Coast?
Yeah, so for those of you who don't know, there's these fire, they're still burning in Canada. And when the winds blow a certain way, the East Coast of the United States, we can smell it. And we haven't been able, we've been told to stay inside. And it's, you know, and so, you know, we're breathing in pollution, a lot of pollution. I mean, like levels that we don't normally see in the US. And that impacts our lungs. That causes inflammation, and it can, you know, cause COPD and asthma attacks, and it can also lead to heart attacks. So there's a lot of different impacts of wildfires on health. I'm trying to think, did that basically answer your question? Were you asking something more detailed?
Yes, it did answer my question. Thank you.
Great. Yeah. Arkan?
Yeah. That's how you do it. Thank you, Dr. Latshaw. I really enjoyed listening to your presentation and how you were able to rise to where you are today, which is really amazing to hear about your career path. One thing I was really wondering about is that if all these problems like urbanization, and as well as humans' exponential growth, they're all caused by climate change, then what do you believe is the leading cause of climate change?
So mankind is the leading cause of climate change. So, you know, if you look at our climate, it has been changing since the beginning of the planet. But the change since the Industrial Revolution has been exponential. And so scientists all agree that it's us burning fossil fuels to heat our homes, to generate electricity, to run our cars, to fly airplanes. And so honestly, you know, a lot of times what industry tries to tell us is, oh, like, you know, just walk instead of driving and you'll have an impact on climate change. But really, if we want to slow down climate change, we need policy change at the government level, at the international and national level. And so, you know, the most important thing is you can write to your legislators, to your governors, to your lawmakers, and you can tell them that they need to crack down on fossil fuel burning, and we need to invest in renewable energy. That's really the only way that we're going to be able to slow climate change.
But I kind of watched a documentary in school, like they showed something called the Gaspersky, where they're saying those methane emissions that were the leading cause. Is that accurate, or which one is more accurate?
So methane is much stronger greenhouse gas. So it's not as, we don't emit as much methane as we do carbon dioxide. But when we do emit methane, it's like 20 times worse than carbon dioxide. So it's definitely a serious problem, but I wouldn't say that that is the number one cause of climate change.
Because
Does that make sense?
A little, because I'm kind of wondering about methane emissions, because it often comes from like grazing cattle as well as the global meat production. So I'm just a little, and like based on watching that documentary, they're saying that methane emissions have been causing climate change 100-fold than carbon dioxide emissions. So I'm just a little confused, given your information, the information I got there.
Yeah, I'm definitely not an expert. So, but I would question who made that documentary, and who they interviewed, and what their, you know, anytime you read anything, you should always question, like, who is telling me this and what are they trying to get out of it? But food systems are a huge contributor to climate change. I 100% agree with them. Food waste is a huge contributor to climate change. And meat production is a very large contributor to climate change. But not as big as the fossil fuel industry, from my understanding. But I'm definitely not an expert. So keep questioning, Arkan. Vinay?
Yes, so first off, thank you for presenting today. Your presentation was very informative. And so my question revolves around something you said around the end. So you're talking about Baltimore's transportation, or Maryland's Transportation Equity Act. I'm correct about that, right?
Yep. Mm-hmm.
Yeah. So I did a little searching just now, and I found out that there was actually a Transportation Equity Act that the federal government passed several years ago, but it was never renewed. So, my question jumps a bit off of that. Is there any current legislation that you would like that environmental health wants to see passed on the federal level, or is there any legislation they want to propose at least?
Yeah, so I don't know if I speak for the whole field, but I'll tell you personally, what I would love to see is much better monitoring in the United States. So every time I talk to people about environmental health issues, like say cancer clusters, like a neighborhood where there's all this cancer, and they say, well, we think it's due to the chemical company down the street. And then they say, well, we want to find out what pollution has been, you know, in our environment over the past 60 years that this chemical company's been around. There's no records. The chemical companies destroyed their records, and we're not collecting a lot of data in the US on what's in our environment. So I would say we need more data on what's in our environment and also what's in our bodies. So what chemicals like that aren't naturally occurring in our bodies are getting into us. And then I would love, so to do that, there's like, we have at CDC has the National Environmental Public Health Tracking Network. And that's basically that collects this type of data. But it only funds like 20 states to do that. And it's not real-time data. And it's it's just not very robust. So I would love to see that fully funded. And there's also a climate change program at CDC that sort of helps states prepare for the health impacts of climate change. And again, that's only funding like 15 states. And we really need every single state in the US to be thinking about the health impacts of climate change. So, and then lastly, we need like an environmental health workforce act. So it's so weird. Nobody knows what environmental health is. My own mother, like, probably couldn't explain what environmental health is. And so not a lot of people come into our field, and we don't pay a good amount. And so it's kind of hard to attract people into our field. And so I think we need like a environmental health workforce act, which has been proposed, that will help to better fund workers and training so that we can, start to make people healthier and have our lives be better. Good question. Thank you. Shri.
Hi, thank you for your presentation. Is very informative, as Vinay said. I know that to combat a way to combat an issue of environmental health, especially in suburban towns, for emissions specifically from vehicles, expanding roads or increasing mobility decreases idle vehicle emissions, especially when those vehicles are stuck in traffic, etc. However, increasing mobility will also increase people deciding to drive instead of biking, for example. And you said this was a very crucial, or it could become exponentially worse, seeing how diabetes and things that are result from a lack of exercise can arise. So especially in suburban towns, how do we balance increasing mobility and also promoting healthier ways for transportation?
Yeah, great question. You guys are awesome. I love it. See, this is what gives me hope for the future. All of these great questions and thoughtfulness. So we have to get around, right? But if you look at traditionally designed communities, especially like in Europe, everything was designed so that you could get there very easily. Like you can walk to work, you can walk to the bank, you can walk to the grocery store, you can walk to wherever you worship. And so I think we need to design communities that are, what we've ended up doing here in the US is we have like suburbia where everything is spread out. And so anytime you want to go anywhere, you basically have to get in your car and go there. And if you try to walk, you like take your life into your own hands. But like everything, like, we have our shopping district over here, we have our residential district over here, and it's all separated. So we need to bring together like the places where we work, learn, play, pray, all of that. And then also we have to think about people with disabilities, right? And so we have to think about how they get around. And but one of the things, so I'm working on the sustainability plan for the university, and I voted that we should like double like the cost of parking for especially for faculty, which I drive, and so it would hurt me, but we need to make driving like not the top choice. But to do that, we have to put the infrastructure in place where there's good public transit system where, you can get where you need to go in a reasonable amount of time. And so it's a very complex answer to a really good question. And we're still working on it. So I think I'll have time for maybe one more question. Rebecca.
Hi, firstly, I wanted to thank you so much for your amazing presentation. I learned so much, and like your whole story and like impact with the National Biomonitoring Network, it's so inspiring to me. And I kind of wanted to go down that healthcare route. I was wondering, as climate change gets worse or as the amount of pollutants get worse over time, how do you think like healthcare facilities will be impacted in their ability to treat like diseases most effectively, if that makes sense?
A lot more physicians are coming to me and organizing around climate change because physicians are realizing like this is a real problem. Heat is one of the things that kills, it's like one of the weather conditions that kills the most people every year. And so like for example, I know one physician who was talking about working with Epic, which is like the hospital's like record keeping system. So when you go to the doctor, a lot of like they will input your information into Epic. And he was saying, like, how can we integrate climate questions into Epic? So in other words, if there's a heat wave, Epic might ding your provider to say, oh, right now there's a heat wave. You might want to reduce your patient's heart medicine because during a heat wave, you know, there can be impacts on blood pressure. And so sort of like trying to like train physicians and poke them to help them think about the impact that climate is having on health. But what we're also seeing too is a lot of physicians who are trying to like get involved in the policy side because they're like, climate is impacting my patient's health. And how can I, you know, how can I fight against the corporate, you know, climate change machine? And so Physicians for Social Responsibility has been really active in this space, for example, and other groups are kind of coming on board. The American Medical Association, I think, did a statement last year on climate change. So yeah, I'm so sorry that there's so many hands up and there's so many things in the chat and I haven't been able to get to them all, but I just saved the chat because I want to go back and read it. And I hope you reach out to me. And stay in touch. And if I can help you guys in any way, you guys I know are going to be the ones that change the world. And so I would love to help you along and guide you and share any wisdom that I've learned in my long life.